I'm Chelsey. I'm one of the practitioners at the Magaziner Center for Wellness. I originally was in traditional medicine, mainly urgent care and family practice for over 10 years. Although I loved treating patients and I value all the knowledge and all my experience there, over several years, I became very frustrated in the sense that I felt like a lot of conditions, a lot of my patients who were dealing with more chronic illnesses, cardiovascular disease, diabetes, autoimmune disorders, cancers, I felt like a lot of what we were doing in traditional medicine wasn't doing them a full service. And in traditional medicine, we're taught a lot of pharmacology. This prescriptions for this symptom, this prescriptions for this disease. And over years of prescribing different medications for a lot of these chronic illnesses, I was finding that it really wasn't treating what was causing the patient's symptom in the first place. And it really caused me to kind of take a step back and to really look into why was that happening for this specific patient, or why was that blood pressure medicine not working? Well, because it wasn't really treating why the person was having high blood pressure in the first place. A lot of these diseases can be prevented and a lot of it can be healed, but it's just a matter of finding out why those symptoms were happening for that person in the first place. So it really caused me to kind of do a lot more research on my own, not only for my patients, but for my own personal health and for my family and for my friends, because I always felt like there was something more that could be done for patients. So it really brought me into, really researching and looking more into functional medicine and integrative medicine, which in turn brought me to this practice, which I absolutely love. When I finally found, the Magaziner Center for Wellness, I felt like such a relief. This is how I want to practice medicine. This is how I want to treat my patients. I want to dive deeper and finding out what is causing those symptoms for that patient instead of just masking and putting a pill for this symptom or that. Why are they having that symptom? To me, that became so important, and it makes my job here so rewarding. I love it. And I love coming to work every day and seeing different patients and how they're healing and how we're able to make, certain adjustments with diet and lifestyle and stress and sleep, because all of those things matter. When I was working in traditional medicine, I didn't have the opportunity to discuss that with patients enough. So I love the fact that here I have the time and I have that opportunity to really get to know my patients and talk to them about it and find out what's going on with them to kind of treat their whole body. And I love it. It's exciting.